change gears to obesity.
Of course.
And we can start by simple definition. When we talk about obesity, what do we mean?
It's clinically defined as if you are a BMI of over 30 and have impairment in health due to that fat deposition, we classify those people as being clinically obese. And it's different to overweight. So overweight would be a BMI of 25 to 30, but it's still not really impacting your day-to-day or your lifestyle, or it's not impairing your health. Now, these are the guidelines for a global kind of population. When it comes to Asia and Africa, the definitions are different. It's 23.5 to 27.5 range that we classify as overweight, and then over 27.5 is when you become clinically obese. And the reasons is that we have seen that it's at that 23.5 that the weight starts impacting your health in Asians and African descent people, but more for the white and the Europeans, those kind of changes start at 25, and the same for the 27.5 and the 30. And when I say the changes, I mean cardiovascular health impact, diabetes for that instance, musculoskeletal, so more risk of fractures because of your weight, and just even changes in moods and mental health. So we see a lot of that with those kind of BMI ranges.
And now, does it mean that when my BMI is high, is that the only parameter we look at? And is it like a true measure that if you're within this range of that is defined as obesity, or this range that is defined as overweight?
So I, for one, do not like the use of BMI, but the problem is that it's a worldly known thing, and we have guidelines and we follow that. But I think it's also important to consider waist to hip ratio and to consider waist circumference. The reason for that is that a person can be a BMI of 30, but majority of their weight is coming from muscle, and they can have only 5% of body fat, which makes him or her a very healthy person. So I think we need to shift our focus more on what percentage of fat, what percent of central obesity if we have. So our waist circumference, our waist to hip ratio, and then work around that a bit more. So let's not obsess over BMI as much as we do. And I think the clinical world is moving, but it's just that we are still waiting to zero down on what that new BMI is going to be. It's just that it's going on for so long, and we know how hard it is to find a new indicator that works for everyone. So it's just a blanket thing that's going on for for a while now, from Second World War. So it's just stayed on. So
it will take a while to change the mindset.
Yes, definitely.
And to just clarify that you're saying your BMI could be high, but that doesn't mean you're obese, especially if it's from muscles. High BMI with high muscle is okay. But high BMI where you have a lot of fat is not okay. And that's why we are talking about central obesity. That's when you have a lot
on your stomach area, and then even your hips.
Which one is worse? Is it when you have it more around your tummy or around your hips?
The central obesity is known to be really associated with all the cardiovascular risks and the diabetes risk a bit more. So I would really focus on the waist more than I would on the hip. But we just store our fats in different places, and this is more for women than it is for men. Men are more likely to store it centrally, but women can actually store it in both places. So, so it's more about that. But I think it's better to just go in for a scan and just get those machines are very readily available, which will now print out what is your fat percentage, body fat percentage versus your muscle mass. And we want to kind of convert that body fat into muscle mass, even if we stay at that BMI of over the recommended one.
So we should not be too worried about the figure of the BMI, but more about our percentage of muscle and percentage of fat.
Yes.
And can we say obesity is a medical condition or is it a lifestyle condition?
I think 10 years back when I did my PhD, this was the struggle of just trying to get people to recognize that obesity is a disease. And we were getting a lot of pushback saying, no, it's not. It's because you chose this. But that is far from true. I think over the years, we have now finally won that battle, and obesity is a disease because it's multifactorial.
Yeah.
No one chooses to be obese. You ask an obese person, they didn't choose to be here. There was a lot more. There was a lot more mental health impact, genetics, that, metabolic disorders that have led to this. It's not their fault. As I said, no one wants to be obese. So that's why it is a disease, and that's why now they're part of guidelines. How do you tackle obesity? And it's a major health crisis because it's costing the healthcare system so much money because of the implications it has on your health, on your cardiometabolic health. So you want to, as soon as it starts costing healthcare money, they recognize it's a real problem.
It's a real problem and
it is a disease.
So that means you can't just look at someone who is obese and just conclude these guys are indisciplined, these guys are not eating right by just looking at them.
Yeah.
Because as you said, there are many factors. There are genetic factors, there are environmental factors, there are hormonal factors that contribute to that.
Exactly.
And I think that's very important for society, because I know we look at big people or obese people with a judgmental eye, looking at them and thinking, this guy is not disciplined, this lady is not disciplined, but there could be more.
Exactly.
There could be an underlying issue.
Exactly.
And I think when we understand that, then we are more graceful.
Yes.
And even in the healthcare space, we are more empowered to look at what could be the other factors that could be causing this obesity.
Exactly. And if we are more empathetic towards them and kind of talk to them more and realize you'll actually help them, because a lot of these people are also bullied for their weight, are not included in things. The more you try and talk to them and include them, that will impact their mental health. They will feel better. And then, because a lot of people have addiction towards these things and they just eat because they're depressed. Some people mindlessly eat and don't even realize, So there's a lot more than that. And some of them are really trying to, they work out, they eat proper, but there's just metabolic issues that they can't deal with. Their hormonal fluctuations, which is causing that. So I always say, whenever you interact with someone who is struggling with it, have empathy and don't blame them and don't judge them because no one wants to be obese.
What is the role of mental health in obesity?
I think it all starts from the head. It all starts from your mind. And there's a lot of misconception that, that person doesn't have the willpower to do it. That's why it does not happen. If willpower was the only thing, I think we would all be here modeling, and doing that. But it's not that easy. There's a massive impact because a lot of people, as I said, if they are depressed, they go to food. I'm not feeling that great. Let me have a bar of chocolate.
Comfort eating.
Comfort eating. And I think that's a very human thing. And I think we all do it, but we are just like, you know what? I'm sitting in front of the television. I'm watching a movie. Let me have a soda. Let me have popcorn. And, and also just sugar is not affecting, it's also the carbs. Popcorn has a lot of unhealthy fats in it, a lot of carbs in it. So we mindlessly eat, that's why we recommend people don't sit in front of the television and eat, because you're mindlessly eating then, and your brain is not telling you it's full. A lot of people, unfortunately face abuse at home. They're bullied in schools because of multiple reasons, not necessarily obesity. And then they come home and what do they find comfort in?
Eating.
It makes them feel a bit better. Why? Because eating, when you're a full stomach, your hormones, your endorphins release, your serotonin, you're like in a happier state. So you just, equate that as feeling good. So I always say when it comes to obesity, and this is a multidisciplinary approach for that reason, when it comes to obesity, you need to talk to your mental health advisors. You need to speak to your support groups. There's also stigma around mental health. So people sometimes don't like to go, but go speak to other people who have faced similar issues. They will impart some knowledge on, how to come up with better strategies to control those moods. So that's why it's very important to, take that help from a psychologist, from a psychiatrist, for them to understand as well what are the key triggers and how to look after those triggers. When are you triggered to, oh, now I think I need a chocolate. Instead of that, what else should you do? I'm not an expert at that, so I can't advise, but really important to speak to your mental health provider for that. So yeah.
So what I hear you say, Natasha, is even for someone out there who could be struggling with their weight, before you think, let me cut on my, carbs, maybe start exercising, it's important to have a medical evaluation because as you've said, you could be having other conditions, either mental or other health issues that could actually be causing you to be obese beyond just the diet and the exercise.
Hypothyroidism is one of those examples. I was gaining weight and I was not understanding. I was going to the gym, I was eating less, still not losing weight, and then went in for my check and realized my, thyroid hormones were off the roof. And then it was like, oh yeah, we need to control for that. So there's a lot more that affects weight than just what you're eating. So, and how much you're moving. So there's a lot of genetic component to it as well, and a mental health component to it.
So I believe there could be people out there, you've tried everything to lose weight. As we say, I've tried everything, but maybe there's something you're missing. There's a diagnosis you could be missing that is causing that, like in your case, what you've mentioned, the hypothyroidism. So I think we need, once we understand that obesity is a disease, we need to normalize having yourself checked to just be sure that we are not dealing with, lack of exercise or bad diet, to just be sure that there's nothing else we are missing, right?
Exactly.
Talking about diet, I've seen a lot of different diets being recommended, especially online. I've seen keto diet, I've seen intermittent fasting, and they are all manner of how to do the intermittent fasting. What's your take on these diets?
Definitely, yes. There's a lot of diets out there, and a lot of people jump into it, and they work for a while because obviously you're shocking the system, and you do end up losing the weight. But it's more about sustainability. Can you sustain on a keto diet which has zero carbs? Again, the thing where I said you need the carbs for energy. You go for a massive workout, come back and are only eating a keto diet, you will feel fatigued the whole day. So it's not really something that's sustainable. The thing about intermittent fasting, again, is if you can fit it into your lifestyle, it's fine, but it's always really important to speak to your healthcare professional, because if certainly you're a type 2 diabetic and you're taking your medication, what times are you taking it on? Because if you're in your fasting state and the medicine's acting and your sugar goes down, it's not really advisable for you to take it. Someone like me, I also tried the intermittent fasting, but I also have hypothyroidism. So when I spoke to my endocrinologist, she suggested actually it's not really the right thing for me. So I think before we go on any of these diets, especially if you have an underlying condition, it's very important to speak to your healthcare professional, your dietitian, or your primary care physician about, is this the right thing for me, rather than jumping into it, because you're just going to damage your body more and kind of end up in the healthcare system a lot more in emergency situations and stuff, and we don't want that. So it's really important to know more about it through your healthcare professional rather than just jump into it, and especially if you have underlying conditions. So very important. So
Wow, that's important. So what I hear you say is that yes, this diet could work, but then not for everyone. Not for everyone, and whatever diet you choose to go with, there's always need to first consult your healthcare provider, because again, we are all different. We could be having different underlying conditions. And then there's something important you've also mentioned about sustainability.
Yes.
Because I've also seen people, you're on this diet for some months, you lose weight, you stop it because, again, it's not sustainable, and then you're back to square zero or negative. Worse than where you started. Yeah.
Definitely.
So we need to put all these things into perspective.
Exactly.
But it's something sustainable and healthy. Our bodies need healthy, balanced diet. Yeah. We can't cut off carbs completely, or cut off vitamins completely, or proteins completely. We need all these things. Yeah.
Exactly.
That was very insightful, Dr. Natasha. Really appreciate your time. What will be your parting shot?
No, thank you for that. Thank you for inviting me. Really appreciate you also taking the time to interact with me. I think my last note would be that don't judge people for how they look, because you don't know what the backstory is. Empathize with them, talk to them, and not just for the obesity side, but also the diabetes side, because every disease, people struggle. They have their internal struggles. So be empathetic and do not blame them for what they are facing, because there's a lot more back there than meets the eye. And the one diet or the one medication doesn't work for everyone. We look different. Our bodies are different. So, just don't, assume that one thing will work for all. So the one bill fits all approach has to be out of the window, and an individualized approach needs to come into place. So, yeah.
Thank you so much, Dr. Natasha.
Lovely speaking to you. Thank you so much for having me.
Thank you. As you go back to UK, pass our African and Kenyan greetings to our UK people.
Will do. Asante.
Thank you.